While COVID-19 infections and deaths in the Western Cape are spiking, there are areas like Klipfontein, Mitchell's Plain and notably Khayelitsha which have recorded fewer cases than during the first wave. Could this mean that they have reached some form of herd immunity? Ayesha Ismail speaks to an expert.
Health authorities are quick to point out that while some areas are showing fewer infections now than during the first wave, their numbers are still high.
So there are actually three sub-districts that show a slightly different pattern. Khayelitsha is the most obvious, but Klipfontein and Mitchell's Plain as well. And those are also the three areas that were hit hardest in the first wave.
But testing patterns are also important. Professor Mary Ann Davies says fewer people in Khayelitsha are likely to access private sector testing facilities. In addition, restricted testing criteria were introduced in the Cape Metro in early December, in which only people older than 45 and ones with comorbidities were tested. She says antibody surveys were also conducted after the first wave.
What we've done is tested people who attend our normal public sector services for reasons other than COVID. So it's people coming for routine HIV care or pregnant women. And what we found is that the antibody prevalence was highest in Khayelitsha, around 45%. Similarly, also very high in Klipfontein at around 45%. And a little bit lower in Mitchell's Plain. We do know that reinfections are possible, but we think that they're relatively rare, and so a large proportion of people may be immune.
The second thing is the much sought-after herd immunity.
Infections can only transmit when an infected person comes into contact with somebody who is not immune. And as you build up that number of non-immunes, the chance that when an infected person meets people, if they meet 10 people, the chance that all 10 of those people are going to be non-immune becomes lower and lower.
This leads to a point where there are too few infections to sustain the pandemic.
We think for SARS-CoV-2 that it's in the region of about 60 or 70%, but we don't know for sure. And so obviously the 45% that I've talked about is not enough to achieve that full herd immunity to actually interrupt transmission, but it does mean that we're approaching that level.
And this could mean a bit of good news. Ayesha Ismail, Cape Town.